Many people seeking asylum in the UK describe feeling alone, frightened and confused. People often suffer with sleeplessness, nightmares and experiencing powerful memories about very difficult past events. This can leave people feeling hopeless and unsure where to get help. We hope this film will help you understand what support is available. Many people find organizations like Bristol Refugee Rights or Borderlands very supportive. They are welcoming and can often answer many questions and provide practical advice and support. Most asylum-seeking people arriving in Bristol or South Gloucestershire will meet someone from the Haven at Montpellier Health Centre or their local health centre. You will be asked about your background and your health needs, and the Haven can support you to register with a doctor or GP near where you live. Your GP is the best person to ask about medication. With time and the right support, people can cope better and life can get easier. Therapy can help people work through their distress and better understand how trauma affects their lives. This film outlines services that can help. These services support people with an asylum-seeking or refugee background, including people who are victims of trafficking. They are free to use and you have the right to ask for support from them. In Bristol, the first step in the NHS is a referral to Bristol Wellbeing Therapies. In South Gloucestershire, this is called South Gloucestershire Talking Therapies. Your GP can give you information about these services. After this referral, you will meet someone from the service to talk about your main difficulties. This is an assessment and is usually face-to-face. The therapist will be experienced in working with people who have been through trauma. While talking to someone may feel upsetting, they will try to find out your needs as sensitively as possible. If at the end of the assessment you decide you would like more help, the assessor will talk through your options for therapy. Therapy is the term used for help working through emotional difficulties with a trained professional. In Bristol, some options for therapy include Womankind, Traumatic Stress Service, and Trauma Foundation Southwest. These all offer a safe space to meet a therapist. Most are specially trained to understand issues of trauma caused by difficulties such as persecution and conflict, sexual violence, and trafficking. They are also aware of the difficulties in moving to a new country and culture, and the effect that claiming asylum can have. Some services offer longer-term work than others. Each service will now be described in more detail. Womankind. Womankind offers a safe space for women to talk through their experiences with a trained female counselor. This can help women make sense of their feelings and understand how their lives are being affected now. You will see the same counselor at the same time each week for up to 6 months, and Womankind can provide a trained female interpreter in your language. What women say.
I am definitely less stressed than before.
Having someone who understood my language and culture was very important.
I am feeling more positive about myself.
My counselor was very kind, generous, caring, and really helpful to me.
The Traumatic Stress Service also supports those who have been through trauma. There are 2 parts to the service. You will be invited to join a Moving On After Trauma or MOTE group. This is a 7 or 8 week course which takes place at different venues in Bristol. The aim of the group is to understand what effect trauma has and learn skills to cope better. In the MOTE group, members are asked not to talk about their trauma, but first learn skills to manage life better. For example, you will learn different breathing and relaxation skills. Men and women meet separately, and bus fares can be reimbursed. All these services will use an interpreter if needed. All interpreters sign a contract to keep information private and will not change what's said. The Traumatic Stress Service also offer one-to-one therapy sessions. You will meet the same therapist either weekly or fortnightly to work through the difficult experiences you have been through.
The therapy helped me a lot and changed really my life. It's not easy to forget about the past, but you can put behind, and you learn a lot of techniques sessions, and that techniques will help you to really recover and put your things in the past and go forward to the present. When you compare the way I was before and the way I am now, I'm really feeling everything is easy for me now. I can talk to my friends, go with my family, not really getting very angry like I used to be before. You can get a lot of help. If you go and talk to the professionals, you will see your life change, the way mine changed.
There are other services outside the NHS who also offer support. Trauma Foundation Southwest is a non-NHS service, offering therapy for however long you need to come to terms with the traumatic experiences you have been through. This may take months or years to work through. Some services do have a waiting list, but you can always find out how long you are likely to wait. It is not usually possible to bring children to groups or therapy sessions, but talk to your therapist about this. Details of how to contact these services will be shown shortly. Your GP or other professionals can often help you with this too. So please tell them if you are struggling, for example with nightmares or sudden memories from the past, and you would like help. Traumatic experiences and seeking asylum in the UK affect everyone differently. There is no pressure for you to ask for extra help or to ask now. You may find your own ways of coping. However, if you would like some more support, help is available now or in the future. There is someone you can talk to.